Carpal tunnel syndrome is a condition whereby the patient complains of numbness in the hand. Now, they will usually give us a story whereby the hand becomes numb. They cannot feel it, almost like lots of pins and needles or lots of ants crawling around the fingertips and the palms. This usually occurs after using the phone, talking on the phone for a few hours, or when they are reading a newspaper. The other common symptom is that they wake up in the early hours of the morning, usually around 3 a.m., 4 a.m., with these sorts of symptoms. And what patients like to do is they like to shake their hand, flick their hands to try to get rid of the symptoms, but usually to not much avail. This condition is, if you ask them, the numbness, they usually say the whole hand, but when you examine them, it usually involves the thumb, the index finger, the middle finger, and half, the radial half of the ring finger. Usually, typically, the little finger and the ulnar half of the ring finger is not affected because that part of the finger, the digits is actually affected, supplied by a different nerve called the ulnar nerve. Now, the median nerve runs in the center of our wrist into the palm, and the compression is generally at this level. There is a ligament called the transverse carpal ligament TCL that runs from here to there. As we grow older, it becomes more thickened and it can compress onto the nerve and it can give us this type of symptoms. Other people who usually get these problems are people who have recently given birth, new mothers. They tend to have some swelling due to water retention. They can have this problem. Ladies near perimenopausal stage of their life tend to have this issue as well. For men, it can be associated with repetitive stress injury, such as construction workers who use power vibration tools. Treatment is usually accurate diagnosis followed by surgery. Carpal tunnel release can be done under local anesthesia. It is very effective and usually the numbness goes away permanently.